John, are we live? Okay. Well, good afternoon, everyone. We are here today to give an update on COVID-19 in the city of Detroit, as well as let you know the efforts that we are currently implementing to get more shots in arms. So thank you for being with us here today. I am joined here by Dr. Iris Taylor, the nursing director for the Detroit Health Department, and Ron Taylor, the president and CEO of the Detroit Area Agency on Aging, and also Dr. Phil Levy, the chief innovation officer from Wayne Health. We're here today because we want Detroiters to stay safe and be healthy, especially as the city continues to open up and resume normal activities. In fact, all of our numbers are trending in the right direction. As you can see, the city of Detroit, we're now at 3.5% for percent positivity, as well as our hospitalizations. Over the last 30 days, hospitalizations have decreased by quite a lot, from 311 down to, on average, around 100. And so we are really pleased on the numbers that we are seeing. And that's because many of you have decided to take this pandemic and continue to take this pandemic seriously. You are still wearing your masks if you are unvaccinated. You're practicing social distancing, you're avoiding crowded areas, and you've also received your vaccination. So thank you to all Detroiters who are continuing to do their part. Now, our vaccination rate is currently at 35.8%, and we've got to do better. We are nowhere near where we want to be at community immunity at 70%. So we do have a long way to go, and it is so important that everyone strongly considers getting vaccinated, not only for themselves, but for their family, for their friends, and for our community. Now, just to remind you, Detroit was one of the very first cities to prioritize vaccines for seniors and those who are experiencing homelessness. We have also made accommodations for people who have disabilities to also get vaccinated at all of our locations. Since then, we've continued to be innovative with door canvassing, offering $2 rides, offering the Good Neighbor program, which incentivizes people to bring Detroiters to any one of our vaccination sites. We've also offered an abundance of sites throughout the city. We have walk-ups and drive-through. We have extended hours on Saturdays, on the weekend. We have pop-ups. I mean, we are doing so much for the city of Detroit. And we even have a health department mobile unit that's on the road at all of the events throughout the summer. So you will see the big green mobile unit, and we will be out there putting shots in arms. So today we are announcing a new strategy to get more shots in arms, and that is our homebound vaccination. We know that there are Detroiters who are sick and shut in. These are Detroiters who are unable to come to any one of our vaccination sites. And they were the only significant population that did not have easy access to our vaccines. And so starting today, Detroiters who are homebound will be contacted by our teams to set up an appointment. When nurses arrive at their home, they will be vaccinated, and also anyone in their household will also get the vaccine if they would like. We have over 150 teams that will be going out to all of our homebound Detroiters. They will be in uniform, and they will have a picture ID for safety purposes. And we are planning to, again, launch today, and we will be completed hopefully by the end of November or December. Again, this is a collective effort. We could not do any of this without our partners that are here with us today, and I want to recognize them for their level of support. I mean, it's really been amazing working with them. The Michigan Department of Health and Human Services for giving us the data that we need to go out into the community. The Detroit Area Agency on Aging, the Maternal Infant Health Program providers, and Wayne Health. Each of these organizations are passionate about making sure Detroiters who want to get vaccinated can get vaccinated, and their partnership will definitely help us be more efficient. And so with that, I'm going to turn it over to Dr. Iris Taylor, who has been leading this effort both day and night, making sure that this program is launched successfully. And so I will turn it over to Dr. Taylor.
Thank you, Denise. Part of our strategy is to ensure that no one gets left behind. So in order to create a collaboration, a collective effort, so that we can ensure that no one gets left behind, that we have our partners. And it's very critical that we acknowledge them, because without that, we would not be able to penetrate this population of individuals who are challenged in being mobile outside of the home. So now what happens when we come to you? We will have a phone bank who will call and make an appointment. They will ask you some basic information, validate your address so that you would know exactly where you're located, and then we will come out, and when we present ourselves, you'll have a picture ID that says they're from the health department and they're here to immunize you according to the appointment schedule that has been provided. The nurse, once she gets there and presents her ID and she comes in, if there's others in your family that are interested in being vaccinated, we will do them as well while we're there. You'll also be asked that question when they call to make appointments. The entire process for an individual will take about 30 to 45 minutes. A couple of minutes for the actual injection, and then another 15 minutes to wait to be sure that there aren't any reactions, particularly if you have a history of having reactions to either vaccines or some other sort of allergy that you might have. So we're going to see to it that you are safe. So again, while we don't want to leave anyone behind, we want to be sure that we provide access, equitable access across the city. And as we do this, for those who are challenged mobily outside of the home, we also want to be sure that you're safe. So we will wear our mask, and we will be safe as we come to you individually. And again, I say to you that this could not happen if we did not have a team of people who are equally passionate about the city of Detroit, and it's the well-being of the citizens to be participants with us in this process. So I'd like to introduce Ron Taylor, who is the president and CEO of the Detroit Area on Aging Agency on Aging, DAAA as we finally call them. Ron?
Thank you so much, Dr. Taylor. And we at the Detroit Area Agency on Aging, we are just extremely pleased to be a part of this city-led initiative in regards to getting vaccinations to our homebound individuals, and then also to individuals that may be disabled. This really allows us to scale up our energies, our efforts, and then also our resources to make certain that we are serving those individuals that are most vulnerable in our community. So I just want to applaud the city of Detroit and also the state of Michigan and our other stakeholders and partners for being progressive and being proactive and making certain that we can get a shot in the arm to those individuals that lack the mobility and also the access to services. So we at Detroit Area Agency on Aging, also known as DAAA, are extremely pleased to be part of this initiative, and we look forward to serving you. Dr. Taylor?
Thank you, Ron. Also critical in our partnership is Wayne Health. And we have with us today Dr. Philip Levy, who is the Chief Innovation Officer of Wayne Health.
Thank you, Dr. Taylor and Denise, for inviting Wayne Health to be part of this monumentous effort. There are tens of thousands of people in this city, perhaps the most vulnerable members of our community, who can't get out of their house to go to one of our vaccination sites, be it a mobile health site that Wayne Health runs, or the many opportunities to get vaccinated through the efforts of the city of Detroit. And we need to do everything we can to reach these folks. And I think the way you, Dr. Taylor, and Denise have brought together this coalition of 150 partners, all of whom care immensely and deeply about the citizens of Detroit in this effort, which is going to be huge. It's a big undertaking. It's 30 to 45 minutes per person, and we're going to thousands upon thousands of homes. But I can say on behalf of Wayne State, we're not going to stop until every person who wants to get vaccinated is vaccinated. And we look forward to having the opportunity, to the invitation to come into the homes of the citizens of Detroit and deliver healthcare services and be there to let you know the community really does care every every second, every day about you and making sure you can be healthy and well. So again, Wayne Health is just delighted to be part of this. I wish we didn't have to do this at all because everyone was vaccinated, but you know what? We got to continue the effort and we're going to keep striving. So thank you for including Wayne Health, and thank you for the incredible effort that the city has undertaken to make sure that all of the citizens of Detroit can get vaccinated.
Thank you, and with that, we'll take any questions you have.
Hi, thank you for the opportunity. It's good to be with you. I have a few kind of odds and ends, and Denise, I'll start with you. When you mentioned 35.8%, obviously 70 is the target. In an overarching sense, why do you think there's still a lot of hesitancy out there?
You know, I'm not sure why there's still hesitancy. We have, I believe, in the city, done an incredible job of offering both education as well as accessibility to many sites all across the city of Detroit. Now it's up to the residents to make the decision. There may be people that are on the fence, and that's okay. We're going to respect their decision. But at the end of the day, this is a personal choice, and I hope they make the right one.
I'm told TCF is still operational, likely will be throughout the summer. I don't know if you have an idea, not to put you to the test, of how many people are coming through there a day now, but I'm asking too, is this more the model, what you're announcing today, as opposed to, obviously you're going to keep both, but the mass vaccination location, I'm not going to say has it played out, but in a way, has it played out?
So this is still very much top of mind for the mayor. This is his approach to ensuring equitable access to everyone in the city of Detroit. Our efforts are not going to decrease. They are going to be enhanced by this homebound vaccination approach. I think we are definitely headed in the right direction. We have a long way to go, but we will continue to maintain our sites for a really long time.
Do we know how many are coming through TCF on a daily basis, roughly?
I don't have those numbers in front of me, but we can get those for you.
All right. A couple other ones I had. When we talk 35.8% vaccinated in the city, do we have a rough idea, meaning are those, 50 and over, better than that on a percentage basis? Or what's the breakdown, if we have a rough idea? Or what areas of the population are we lacking, if you will, in terms of getting vaccines?
So we have, I believe, done an incredible job of getting the word out there and making sure that we are meeting people where they are. All of the data that you're asking is available on our dashboard. And if it's not there, you can let us know and we can get that information for you.
Thank you. Lastly, I don't know if Mr. Taylor would be appropriate or anybody, but I'm just curious the challenge on identifying people homebound and how we branch out and reach out to them and get to the right doorsteps and if you can kind of paraphrase how, to a layperson, the challenge, a big a challenge that is.
Yeah, I believe Dr. Taylor may be able to address that a little bit better. But from some of the issues in which we've seen has been just kind of the duplication of numbers and ensuring that we scrub the information to the best of our abilities. But I do know that the city of Detroit, in collaboration with the state of Michigan, they have identified a number of, we've estimated that there's probably about 40,000 individuals in the community that may be homebound or in need of services. And based upon their collective efforts, they've been able to kind of clean that information up and identify those individuals that are still in need of vaccinations.
Any follow-up with that, or you?
Yes, actually, yes, the state of Michigan has provided us with the initial list. And to that list, if anyone calls in or there is a referral from other community-based organizations, we would then look to be sure that that person is not already on the list. And if they aren't, we will integrate them into the list so that as we go out geographically across the city of Detroit, that we will reach out to everyone who is challenged mobily outside of the home.
Thank you.
We have a question here from Sarah Rahal from the Detroit News. Part of this has already been answered as far as how many residents. Thank you, Mr. Taylor. She also asks, what's that population look like? And she also knows the DAAA tends to more than Detroit. Is this strictly a city effort for you, or will you be reaching out to homebound people outside of the city?
Primarily, our first thrust is to look at those citizens of the city of Detroit. And the definition of homebound is anyone who has a challenge being mobile outside of the home. So that could be a teenager, it could be someone in the 20s, 30s, 40s, so it's not age-driven or is it disease-driven.
Yes, and I'll say that we've been very fortunate to have other stakeholders that have come forward because we do, Detroit, the DAAA, we do operate in 9 communities, with Detroit being our primary hub. But we've partnered with a number of other, I would say, fairly qualified health centers and other entities that will allow us to provide services to those that are outside of the Detroit city limits.
Great. Christina Hall from the Detroit Free Press also asks a few of those similar questions that have already been answered, but she also asks, what vaccine will the residents be given or offered?
When they call for their appointments, they'll be offered either Pfizer or J&J, and it would be their choice.
Thank you.